I'm Cassandra and I work with ThedaCare. I'm also a busy mom of 3.
Camden, no thanks. Hey.
Doing it all is more challenging than ever, and that includes making healthcare decisions. So, welcome to Health Inspired Talk, where we cut through the confusion, we chat with experts, and we help you get the care you need for you and your family. Most people know that February is Heart Month, and both men and women alike have a risk for heart disease. But studies show that women tend to underestimate their risk. So today, we're at the Building for Kids Children's Museum in Appleton to talk to women around the Fox Valley about this important topic. So let's go chat with them. First question for you, probably an easy one. What do you do to make sure that your children stay healthy?
Making sure they have access to lots of vegetables and fruit, and we do lots of playing so that they get exercise and movement.
She eats fruits and vegetables every day, and we like to go for a walk.
Make sure they get plenty of exercise, make sure they eat right. Grandma takes them on lots of excursions.
Moms have to make time for themselves, so what do you do for your health?
We recently bought a treadmill, so I'm able to get on the treadmill while she naps.
What do you do to take care of your health?
I try to exercise regularly. I eat primarily a plant-based diet, and I have 2 young boys, so it is really not hard to stay active for me. I find myself running around chasing them pretty much every day.
Do you eat good veggies and fruits?
Yes.
What's your favorite?
Carrots.
Do you like spinach?
No.
What do you do for your own health?
I'm involved in this great group called Fit Moms in the Valley, so it's a great opportunity to go for walks with other moms, even in these cold winter months.
Most doctors recommend knowing a few numbers to kind of monitor your heart health. Do you know what some of those numbers are?
I don't.
And what about blood pressure and cholesterol, things like that? Do you monitor?
I don't.
Do you know some of those numbers that they always recommend to know?
Well, they always wanted the triglycerides 150 or under. Cholesterol was, I think, 200 or below.
You are so well versed in these numbers and blood pressure and things like that. So
120 over 80, but I know they keep lowering that too.
I think we often, as women, think about our kids. I mean, I'm a great example. I'm talking about them constantly right now, but I think you are busy with putting their appointments together and trying to make sure that they're all taken care of, that sometimes I think you put yourself last. And so you have to remind yourself that you have to be there in order to take care of them. And so making sure that you're healthy is super important as well.
a busy day hearing from moms in the Fox Valley. Now let's dive deeper into heart health. Efforts, including the American Heart Association's Go Red for Women campaign, have played a huge role in raising awareness around the issue of women's heart health. However, there is still work to do. Cardiovascular disease remains the #1 killer of women, causing 1 in 3 deaths every year. So let's take a look at 5 surprising facts around women's heart health, courtesy of the American Heart Association. First one here, many women underestimate the risk. Cardiovascular disease kills more women than all forms of cancer combined, and yet only 44% of women recognize that cardiovascular disease is their greatest health threat. Number 2 on the list, it's not just an issue for older women. Among females 20 years and older, nearly 45% are living with some kind of cardiovascular disease, and fewer than 50% of women entering pregnancy in the US have good heart health. Pregnant women and new moms should take note of number 3. Cardiovascular disease is the #1 killer of new moms and accounts for over 1/3 of maternal deaths. Black women have some of the highest maternal mortality rates. In addition, 10 to 20% of women will have a health issue during pregnancy. High blood pressure, preeclampsia, and gestational diabetes during pregnancy greatly increases a woman's risk for developing cardiovascular disease later on in life. Number 4, watch for changes around menopause. Going through menopause doesn't cause cardiovascular disease, but the approach of menopause marks a point in midlife when women's cardiovascular risk factors can accelerate. This makes increased focus on health during that change absolutely crucial. Number 5, let's end on a positive note. Most cardiac and stroke events can be prevented through education and lifestyle changes, such as moving more, eating well, and managing blood pressure. Joining us now is Katie Burst, a family medicine nurse practitioner with ThedaCare Physicians Darboy. Katie, thanks for being with us. We're talking about how primary care plays a really important role in women's heart health. So to start out with, can you just tell us a little bit about what women should know and the things they should be talking about with their primary care providers?
Yeah, absolutely. Thank you for having me. So, of course, the first thing is blood pressure. So your blood pressure, you hear that a lot when it comes to heart health. When you come into your PCP's office, the first thing we do is we get your vitals. So one of those being your blood pressure. It's a cuff that goes around your arm. So we like that number around 120/80. You have a top number of your blood pressure and a bottom number of your blood pressure. If your blood pressure is too high for an extended period of time, it can cause heart damage. So that being your heart weakens, because it's working in overdrive. The left ventricle of your heart can thicken. And it can also cause strokes, heart attacks, and other clotting events, which we want to avoid.
So blood pressure, one of those numbers that we should all be thinking about with our primary care provider. What are some other things and other numbers that we should be keeping in mind?
Sure. Another number that I like to kind of think about is your blood sugar. So that's the sugars in your blood, your blood glucose, you hear that a lot. And we know that relates to diabetes, type 2 diabetes. So when you come in for your annual exam and when you come to see us, we get your blood. So that would just be a blood poke. So your blood sugar would be in there, so your glucose. So we like your glucose less than 100.
Okay.
When your blood sugar is too high for extended periods of time, again, that's when we start to get into like a type 2 diabetes diagnosis. The other would be your lipid or your cholesterol panel. So again, that would just be a blood poke. So both of these levels, your blood sugar and your cholesterol, can just come off of one simple little blood poke. So your cholesterol, we like less than 200.
Okay.
So your cholesterol, you say cholesterol, people always think that cholesterol is bad.
Yes.
Cholesterol's bad. Cholesterol's not bad. Cholesterol, we need it in our body to help metabolize hormones, to stabilize proteins, your organs, your tissues. Cholesterol can be good, but too much of it can clog up in your arteries and cause, again, clotting events like your stroke, your heart attack. Another number that we like to look for as it relates to heart health and, when we come into our annual exam and do our assessment is BMI. So BMI is your body mass index. It's just, generally it's a way that your height and weight relate to one another. So from there, then you get a number. We like the number, your BMI, between 20 and 25. That means that your weight is good for your height.
Now, we of course want to end on a positive note here. What are some things that women and men can do to help with these numbers and keep them at the right levels?
Yeah, so that's a good question. So of course, we always eat healthy, stay active. So eat healthy, what is that? Well, you can, eat your fruits and veggies, try to eat your salmon or your other healthy meats. Generally, I like to say stay away from saturated fats. So saturated fats, as a general rule, would be anything that comes in a box or a bag. Eat your nuts, eat your berries, maybe make a healthy choice, and when you're looking for a snack, switch out instead of chips, try to have an apple or a banana, and just stay active. Don't smoke. Smoking can cause a lot of heart issues as well.
And you also said stay active.
Yeah,
That's
stay
incredibly
active.
important, right?
Stay active, yeah. And a lot of females that come to me, they're like, I just don't have the time.
I was getting ready to say that
Yeah.
exact same thing.
Yeah.
It's so hard for women because they just don't have the time.
Yeah, as a mom myself and a working woman myself, I have such a hard time finding, I can only imagine people with more kids. I only have one child, but it's hard to find the time. But exercise is also very important to me time. And it doesn't have to be, you don't have to run 10 miles. You don't have to do an hour-long, HIIT, the high-intensity workout where you're like sweating. It can be something as simple as, again, just going for a walk around the block. It's great. It's a great place to start. You can be incremental about it. You can start, with maybe 5-10 minutes a day. And once it becomes part of your daily routine or habit, it becomes easier to build on.
Okay, all right. Thank you so much, Katie. We appreciate you being with us and sharing this information. And again, like we've said, one of the most important things is visiting your primary care provider. To make an appointment for a wellness visit, just visit My ThedaCare. And thanks for watching. At ThedaCare, our mission is to help you live your unique best life. And we want to know what kind of questions you have when it comes to your health care. Leave your questions and comments below. And be sure to like and subscribe so you see the very latest in this series.